Thank you so much for coming. My name is Roz McConnaughy. I'm the Assistant Director for Education and Outreach at the School of Medicine Library, and Betty Phillips came along with me to help assist if we have any questions and when we're working through a hands-on activity later. And she is our interlibrary loan and education and outreach specialist. And this morning we're going to talk about some quality health and nutrition information, the Medline Plus website, and more. So I always like to start off with a quiz or activity. So let's come up with a list of 6 types of apples. Anybody, you can just start. Honeycrisp.
Gala.
Gala.
Fuji.
Yes. And what did you say? Macintosh. Fuji.
Pink Lady.
Pink Lady. Okay.
Oh, yeah.
Yeah.
Delicious.
Yes. Yes. Well, we hit 8. So there's over 1,000 types of apples that I learned, and I thought that'd be a fun way to start the class off, since it is kind of the end of apple season, and apples are low in calories and high in fiber and a good nutritious snack. And today we're going to be talking about the quality nutrition content from freely available health information resources. One of your handouts has the logos with it. Those are the 4 sites we're going to take a look at this morning. And I'll be going through some of the different websites, and you're welcome to follow along or just watch. And then I had kind of a hands-on activity towards the end of the class, so you can get some hands-on experience, although I don't see anybody else. Well, we might be able to do some of it with our phones to see if we can find the answers to some of the questions. But I think we're all probably aware of the obesity epidemic in this country and our poor eating habits that many of us have. According to a 2010 study, 9 in 10 children don't eat enough vegetables. That same study found that children are not eating the required amounts of fruit per day. Approximately 1/2 of U.S. adults consume at least 1 sugar-sweetened beverage on a given day, and research shows that having those sugar-sweetened drinks there's correlations between that and metabolic syndrome and diabetes. And approximately 1 in 3 adults and 1 in 6 children and adolescents are obese, and that was from Healthy People 2020. And so making healthy choices and learning about nutrition can help prevent chronic conditions such as heart disease and stroke, obesity, certain cancers, osteoporosis, and type 2 diabetes. So here is the list of websites we're going to take a look at, and they have at least 3 things in common. They're all freely available. They all are hosted by medical or health organizations. And thirdly, you can find nutrition content as well as healthy recipes on all of those. So first, we're going to start off talking about Medline Plus. It's one of my favorite websites to teach. It's designed for consumers, the general public. It comes from the National Library of Medicine, the largest medical library in the world, located in Bethesda, Maryland, and which is part of the National Institutes of Health. And the National Institutes of Health, probably everybody has heard of, but they're made up of 27 different research institutions, and they're federally funded. Medline Plus is free, it's updated daily, it's mobile friendly, so you can use it on any device. And one of my favorite things about it is there is no advertising that you'll see on there, no sponsored organization, so all that's cut out from the website. And Medline Plus gets over 1 billion visitors per day, the website, but I'm still finding a lot of people that aren't aware of the site. So we talked about that there's no advertising or commercial endorsements. They have quality controlled standards, so everything is reviewed that they link to. And they also have special information that's an icon for easy to read and understand material. So that's a 5 to 8th grade level literacy level meets getting that symbol next to it. a snapshot of some of the content they offer, over 1,000 health topic pages. And I kind of like to compare these to the pathfinders that we used to make in print and libraries. So list of topics with resources. So medical librarians there are creating those, and they're reviewed every 6 months, and they're adding new content to it, possibly daily, depending on the topic. They have an illustrated medical encyclopedia, and while their focus is linking to any NIH documents that it's written at a health consumer health level information, .gov sites, .org sites they link to. So there's information from over 1,350 organizations on this website that's already kind of reviewed for quality. So I'm going to go live to Medline Plus. Okay, so medlineplus.gov is the URL for the site, and there are 3 main topic areas for the site. You can see kind of going across the top. Let's see how I'm scrolling on here. The health topics, and down on the lower, on the left side of the page, health topics, drug supplements, and videos and tools. And let's take a look at the health topics area. So you can browse the alphabetical list. There's also a search box in the upper right, but I was just going to show examples of each of the primary content areas and then run a search and show you what that looks like. You can browse by body location systems, by disorders and conditions, by specific demographic groups, or if we look at the health and wellness area on the right, there is a whole section for food and nutrition. So here's a listing of all their health topic pages. And I'm going to jump to the diets health topic page. So up at the top, this is kind of like a table of contents of what's on the page. They cover the basics. There's learn more, research, resources for you. So articles for particular age groups, children, teenagers, older adults. And always at the top, they have a summary about the topic. And usually that's content from the National Institutes of Health. And so they're linking to articles that they've selected as high quality from other organizations. And over in parentheses, you can see who that organization is. And each link will open up into a new window so you can get back to that health topic page. And let's just look at a couple examples. So the weight loss, choosing a diet that's right for you, is coming from the Mayo Clinic. So opening up in a new window, let me jump back here. So they go through some articles about related issues, dieting and gallstones.
And it looks like a lot of things are also available in Spanish. Is that pretty typical?
Yes, about 75% of the website is available in Spanish. And they have a nice feature up at the top of these health topic pages. You can toggle back and forth from English to Spanish. So if you may not be fluent, you could at least get to the English health topic page and toggle over if there's Spanish available. So yeah, they do try to make most of the website available in Spanish. And then I'll point out later, they also have a variety of materials in other languages too. So let me jump back to English. And as we work our way down the page, I wanted to point out they will link to some of the other databases that the National Library of Medicine creates that are also freely available. One of those is the clinicaltrials.gov site, and I'll click on the weight loss link for that. So clinicaltrials.gov is also created by the National Library of Medicine, and patrons may never be interested in these, but if somebody has a very rare condition or different cancer therapies aren't working for them, they may start searching for clinical trials in their area to receive some of the latest research that's going on. By default, it's just giving us a national listing of different weight loss trials that are going on around the country. But if we go to the modify search, you could start drilling down to South Carolina, or even search for city. When I tried this out, just limited to South Carolina, there was just one study, so I didn't limit further. So this is a weight loss study related to breast cancer that's going on in multiple locations around the country. Let me jump back to that health topic page, and the next section, they'll link to current research. The Medline Plus name comes from Medline, the Medline database, and that's the primary journal article database that doctors and other healthcare providers use to read about the latest research being published in medical journals. So Medline Plus is for consumers, but they will have links to certain articles that are available in the Medline database. PubMed is the freely available interface for searching Medline. And if I just click on diets here, it'll go into, well, except not this morning because it knows I'm teaching a class. Let me try that again. It usually will bring up a canned search of diets, and let me just click on one of these articles. Something's going on with PubMed this morning. But just like the clinical trials, you may not have many patrons that feel comfortable reading medical terminology and jargon, but others might be more comfortable with that and be searching the medical literature. And when you do click on that link, over on the left-hand side, there is an option to limit your search to free full text, because a lot of those articles are going to be in subscription-based journals, medical journals that we spend thousands and thousands at the School of Medicine each year in subscribing, but there is an option for free full text to limit to what's freely available if you're at a public library or at home searching and not affiliated with the medical library. But again, if sometimes we'll get people coming in that their child might have a very rare condition and there's not content on Medline Plus or Google, and sometimes the journal literature is the only place where they can find content on some of these really rare topics. Okay, so down towards the bottom of the health topic page is when we get into different for different groups, so articles for children, teens related to diets, and older adults. And then at the bottom, they'll link to patient handouts, which are articles that are coming from their medical encyclopedia. So that is what a health topic page looks like. And let's go over to the drug and supplements area. So at the top, they license a drug database from the AHFS, and that stands for the American Society of Health System Pharmacists, updated monthly. It's updated monthly, and I find it more easy to understand than the printout you get from the pharmacy of the information about the drug. If for some reason you wanted to read that, they do at the National Library of Medicine have a database of those prescription handouts in their daily med database. I wanted to show an example of an article from the herbs and supplements, because that's related to diet and nutrition and what we're eating, and a lot of people might turn to supplements for cheaper options to treat potential health conditions that they have. And one of the NIH institutes, the National Center for Complementary and Integrative Health, some of the content's coming from there, as well as this Natural Medicines Comprehensive Database. And I have a friend with high blood pressure that takes cinnamon to help with that, so I was going to show what one of the articles looks like. So what I really like that they do is that they summarize the very jargony journal literature content for you. So they'll say, how much do we know? What have we learned? Right now, studies aren't supporting the use of cinnamon in any health condition. In 2012, a systematic review, and a systematic review, if you're not familiar with what one of those are, it's kind of the gold standard of medical journal literature. So when you find a systematic review on a topic, it's summarizing many, potentially hundreds of research studies on a topic to see, what is the evidence out there on this topic. So they're saying that they're looking at randomized controlled clinical trials with people with 1 or type 2 diabetes, and it's not showing cinnamon to help with glucose levels. And then it's also talking about safety, because as you probably know, there can be contraindications like with grapefruit and certain medications that you're eating. So how safe is this to be taking as a supplement? And then towards the bottom, they'll give you a list of references where they're getting this content from, and when, that all important, when was this last updated and looked at? So that's an example of one of the supplement articles. And then that third main content section are the videos and tools. And I don't use this section as often, but they have some health videos, health check tools that you can look at. Over on the right, they do have an understanding medical words tutorial or evaluating health information tutorial that you can point out to folks. So going to the health check tools, I think I went to C. They have, again, they're linking out to health tools that they found at other websites. And so this is coming from the International Osteoporosis Foundation, their calcium calculator, to see how much. Oh, there, PubMed finally loaded for me as we wait for this to pop up. Okay, so here it's asking you to kind of enter in how much of these things you're consuming per week, and then it'll give you an estimate for your calcium intake. So some interactive tools that they have. And since we're going to be coming up on the lunch hour here, we'll go into lunch. Yeah, they do have some great photos. So a lot of these are coming from an NIH group or some other websites. So let's check out the lentil taco filling. They give the nutrition information over on the right. So that's an example of one of their recipes. I also wanted to point out towards the bottom, those easy to read materials. They'll show up as links in the health topic pages, but if you are working with a patron that has low literacy levels or things you just wanted to print out and have on hand, you could come here and let's see, I'll just take a look at the alcohol facts. So again, these are identified from the different organizations, it being from a 5th to 8th grade reading level. Next to that easy to read area on the homepage are the other resources in multiple languages. And they have a very comprehensive list, and it varies what's available. But let's say I'm trying to help a German speaker in my library. Here's some of the handouts that they have or articles. And what I love about these is that they have it available in English and German. So you can see what you're recommending or pointing out to them and look at the English as well as the German. Okay, so we've really covered a lot of the different content that's available on this website. And we talked about their quality guidelines, and they do list them down at the bottom of the page. So they're linking to, they're reviewing the quality, authority, and accuracy of it, when were things last updated, things that we know to look out for when we're trying to find health information. I wanted to point out how the search box works. It will automatically and things, but you can use and or not. It also accepts phrase searching. So if I want to do a search for peanut allergy, I think it auto popped up. But so when you run a search, it's going to try to find a health topic page on your topic, and that would be the first result. There isn't one specifically for food. For peanut allergy, there is one for food allergy. So it's giving me links to some of the content from the food allergy health topic page that's related to peanut allergy. If you wanted to just drill down to a specific content area like the medical encyclopedia, you could do that over on the left. I also wanted to point out, and I think I gave everybody a sample copy, and I brought extras if you want to take some of those back to your libraries. They publish with NIH the Medline Plus magazine, and they have it print copies as well as an electronic version. And they usually have some sort of celebrity or patient talking about health condition or disease and how it's impacted their life. And the great feature is that you can request free copies to be sent to you to libraries and different health clinics. I think on this handout, I put the Medline Plus magazine order form link so you can request copies. I think it does 5 or 50 per library. And the issues come out quarterly. And I think we covered everything I wanted to with Medline Plus. There's just a lot of variety in the content that's available. And under the About Medline Plus area, I wanted to point out they do have some training materials. So if you want to go back and show staff at your library, you go to About Medline Plus, and then there's the link to training materials. So there's about a 2-minute tour of the Medline Plus site in English or Spanish. The Medline Plus trifold brochure that I passed out, the link to it is available there, so it's free to print out. And they do have some more in-depth tutorials, like evaluating health information online, finding quality health information on the web. So that's where their training materials are. Any questions about Medline Plus? Yeah. What they're looking at. I haven't looked for any of those recently. So no, yeah. I don't know if on the homepage they usually focus on maybe like the health observance of the month, but yeah, I think the only stat that I saw from them recently was the 1 million visitors to the site a day.
Wow.
Yeah. Okay, let's go look at one of the other websites. Sorry, here we go. And eatright.org. Let me give you a little bit of background about Eat Right. And this is a website coming from dietitian and nutritionist professionals. In fact, it's the world's largest organization of food and nutrition professionals, and it was founded in Cleveland in 1917. And the eatright.org site, as you would guess, has information about food and nutrition. Yeah. And they will, Medline Plus does link to deep level content of these next 3 sites that we're going to look at. We agree to their cookie preferences. So they have 3 broad categories of food, health, and fitness. So one of their featured articles right now, calories burned during physical activity. And their articles are generally pretty brief. The site's mobile friendly. And I think if I go under food, and then let's look at some of the planning and prep tools they have. So eating right on a budget. And I think a real strength of this website are all the videos that they have available. So of course they're talking about what registered dietitians do. And then they also have videos like eating right on a budget, basics of meal prepping, children and picky eating, nutrition for active kids. And that's all I wanted to point out here. The next site is an organization we've all probably heard of, the American Heart Association. A little background about them. They 6 cardiologists founded the American Heart Association in 1924, and they're the nation's oldest and largest voluntary organization focusing on heart disease. And all of the content on their website is peer-reviewed by their staff and their team of science and medical advisors. And they have a variety of content on their website. I was just wanting to focus on the healthy eating area on their website. So on their homepage of the healthy eating area right now, they have an article on meal planning that they're highlighting. And their 3 main sections are eating smart, losing weight, and cooking skills. And then they also have this Healthy for Good free program to help with dieting and good nutrition. Let's go into the cooking skills. And they also have several videos that are available too, in addition to just the articles that you can read. Let's take a look at what's under shopping. So some of the articles they have, how to choose and cook leaner cuts of meat, family grocery shopping tips. And that one's actually a video. And I've just been browsing these, but they all do have, all these websites have search features that you can use. And the last 2 sites I wanted to show you some examples from are related to kids' health. And the NEMRS is a nonprofit children's health system with locations in a variety of states, Delaware, Florida, Georgia, and New Jersey are some of them. All the content is doctor reviewed. And one of the features I really like about this website is there's a certain button you can click on if you're a parent, or an area for kids written at their level and to what they might be interested in, as well as teens. See, and those are those 3 areas at the top, and they also have an area for educators with some lessons plans that they can use. So taking a look at what we can find under parents, and again, they have general health information, but also information on nutrition. So looking at nutrition, fitness, there's a nutrition guide for toddlers. And their site is very accessible. They have a listen and button you can click on to have the web page read to you. There's also a quick option to enlarge or decrease the size of the font or print out copies. Under the kids area, they've got recipes and cooking. So these are easy to make recipes that you can try with children. I'll just click on the blueberry oatmeal squares. Again, they'll even read, there's a button to have it read out. Under the teens section, you can go to food and fitness. And let's try out nutrition basics. Oops. There's an article about caffeine. So those are some examples of what you can find on the kidshealth.org website. And finally, the last website is a activity and nutrition program that comes out of 4 of the NIH institutes, and it's called We Can, standing for Ways to Enhance Children's Activity and Nutrition. And you can just Google We Can NIH instead of entering in this really long URL. And this is probably the website out of the 4 that has the smallest level of content, but I think it has some good articles and PDFs in it, so that's why I wanted to point it out. And it also has lists of activities like the Apple quiz that we had at the beginning. It has a list of potential nutrition-related activities. Their 3 areas are eat right, get active, and reduce screen time. So let's check out Eat Right. And this program started in 2005. Let's look at the You Are What You Eat PDF. So foods they recommend that are go foods, slow, and the whoa only occasionally. So the National Library of Medicine is divided into different regions, and so we're in the Southeastern Atlantic region for their network. But a couple of things I wanted to point out, their National Health Observances link, and these are all listed for you at the bottom of your handout. The healthfinder.gov, yet another freely available federal website, has different health observances for each month, but the National Library of Medicine has come up with some additional content to go along with those different health observances that you might want to focus on. So just looking at what they have available for March, they have an electronic bulletin slide, some different handouts. Sometimes they'll have webinars to go along with those that are freely available. You just have to register for a username and password, and if they're passed, they usually do recordings of those, so you could go back and look at those. There's some content for National Poison Prevention Week, April Minority Health Month, so they also have some social media materials available there. And then they have some projects from the National Library of Medicine that they're trying to do with public libraries. And this page highlights some of those that are available. They have a Libraries Transform Health Literacy Toolkit that's freely available that they came up with ALA. They also have a Promoting Health Communities program. There is a consumer health certification that you can get that comes from the Medical Library Association to help train you to provide consumer health support to patrons. And then they have a quality improvement program too that they're doing. And then I also wanted to just point out some of the services that they have from our particular national network of libraries in medicine, the Southeast region. It's free to become a member. at the individual level or for your library. And you can, they provide those free webinars and presentations. They will also come to your library and do in-house classes. They have funding opportunities that are available. So those are some of the things that they provide.